Hello, friends. Jeanice Mitchell, pelvic health physical therapist. I am located in Central Texas, and I'm really happy to have this Zoom session with my friend Gerard Green from the United Kingdom. Tell us a little bit about yourself, Gerard.
Hi, Jeanice. Really great to see you, and thanks for asking me to do this. I'm truly honored to do it. So I'm a pelvic health physiotherapist. I'm based in the UK, in Birmingham, which is our second city. And I've got several pelvic health clinics where we do see lots of pregnant, lots of postnatal patients. We see lots of female pelvic health, and also we see lots of male pelvic health. And outside of the clinics, I work in, do 2 days in Coventry University, where I do lots of teaching and research. And a bit like you, Jeanice, I'm really passionate about getting more PTs involved in pelvic health. And also really passionate about getting kind of more help and support and guidance to all these female patients who may have pelvic health issues, pregnancy, postnatal, some unrelated to pregnancy, and also to getting more help for all the guys out there with pelvic health problems.
Yes, everyone has a pelvic floor, right? And everyone pees and poops and needs to and hopefully has sex. Well, at whatever point they want to. So anyways, sometimes I go off on tangents.
That's okay.
And you can tell that I just spontaneously say things.
I've noticed.
Okay, well, so we're going to start off with our session on COVID tips for moms and moms to be. So let's go ahead. We got a lot of great questions in the story box, and then also, you know, I think if you have any resources in addition to share, in addition to the questions. So I thought we might just jump into the questions here. So the first question is, I have pelvic pressure while baby wearing. She's 5 weeks postpartum. Any tips?
Yeah, I think so. That's quite a common question that we get from lots of our new mums, particularly that maybe pressure vaginally, maybe that feeling of kind of bulging. I think there's a few things that's really important. I think especially at the minute with COVID-19, one thing is, what's the bowel function like? I think a lot of the mums that I'm seeing online at the minute are reporting of, you know, lots of constipation, lots of not being able to kind of get out with the baby because of our social distancing. We're kind of quarantined at home, and that, you know, that forced inactivity is not good for bowel function. Also, so some ways to kind of address that is trying to do less straining on the loo. Using something like a squatty potty is really good. Trying to do some of that deep breathing on the loo. Also, you know, it depends what country you're listening in. Here in the UK, we are allowed to leave the house and exercise once a day. And I think even speaking to my mums, because, you know, being a new mum is a busy time. You know, I've got 4 children myself. It's important to try and get out of the house and to take that exercise, whether that's with the buggy, if they have a partner at home, that they can maybe, it's good for them to get out on their own as well, obviously, because that's good for physical and kind of good mental health.
Yes. And good for the baby too.
And I think also trying to, although we are in lockdown in most countries, whether you're listening in maybe Texas or another part of the States, a lot of those brilliant pelvic floor physiotherapists are still available to you online. So you can, you know, have a one-to-one with them online, or some clinics are still open. And it's important, if people are feeling that kind of pressure, which may be suggestive, maybe mild symptoms of prolapse, that they go and get that looked at also.
Mm-hmm. That's good. I'm going to add external support. So I'm a huge fan of supporting the tissue externally. And so I am actually wearing a little external support here. This is called the Hideaway, but there's a lot of different options. So I think you can see it here too, the Hideaway. Yep. So I have 2 cameras going. So that's one option. And of course you wouldn't wear this outside your pants. You would wear this inside, you know, to keep it hidden away. Another nice option are some supportive kind of compressive shorts.
Yes,
and
definitely.
these right here actually have built-in, I don't know if you can see that very well, but built-in perineal support. They're made by this company, EVB Sport. So
Yeah, they do brilliant work. Yeah, so that's it. That's Yvonne's company, which is, and she's a really, really big supporter of pelvic health physiotherapy.
Yes, I haven't met her in person, but I've met, you know, connected with her virtually, and she's amazing. So those are a couple options. And if you don't, you know, have the funds right now to go buy some external support, you can look in your own closets. If this is kind of a tip that I use, so if you're wearing leggings, so like exercise leggings, and if you're seeing a lot of jiggle, 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 then your pelvic organs are probably jiggly, jiggly, jiggly more. But if you wear some type of more compressive exercise leggings that give you a little more support and there's not quite as much jiggle, those are more likely to give you a little more support and compression from the outside. And that's something easy that you could do right now. And you also, with the baby wearing, if you're having symptoms, listen to your body. So if some of these things that we're saying don't work, I would take a break. You don't need to baby wear 24/7. Those symptoms are your body's warning sign that you may not be ready to do what you're doing yet.
Brilliant.
Okay, great. So the next one is a big one. How do I get rid of pubic symphysis pain? She is 5 months postpartum.
Okay, so we know that pubic symphysis, so the pubic symphysis, for just to really clarify for people, so the pubic symphysis is that kind of joint, as if by magic, it's that joint at the front of the pelvis where the right and left pubic bones kind of form together. And we know that that's really common in the in kind of later stages of pregnancy, where we probably have about maybe 70-80% of women develop some symptoms, probably about a quarter of that quite significant symptoms. And we do know that a small percentage of women will continue to get those symptoms postnatally. I think that when we look at those women in clinic or now online, although they may be getting symptoms in the pubic symphysis, we look at it a bit wider than that. So we look at, well, you know, what's that hip movement like? It's good to do some very gentle hip movement, because the big kind of adductor muscles, the muscles at the inside of the thigh, which they kind of attach up in, oh, it's like a Barbie doll. So those muscles attach up into the pubic bone, and they can get quite tight, bit overactive, and that can kind of mimic the pain. So although that's a muscular type problem, it can kind of mimic the kind of joint pain. So doing some kind of gentle hip work is really good. It's also good to do some kind of gentle work to get that lumbar spine and pelvis moving. That might be in kind of 4-point kneeling, so on your hands and knees, doing some kind of hollowing and arching. I have a feeling Jeanice is going to do that now. Excellent. Yeah. That's really good. Kind of some gentle spinal movements in standing. So really trying to get some movement back into those hips and spine. The other thing we know about the pubic symphysis is that there are some really big muscle groups attaching to that area. I kind of like to think of it as a big junctional area. We've got those big hip muscles coming up to it. We've got the six-pack muscles coming down to it. And we know that those kind of take, you know, they take a lot of stress during pregnancy, and sometimes you can have areas of almost a bit overactivity in those as well. So you get like an increased pull at that joint. But I think sometimes what people maybe forget is that at the back of that pubic area, you've got the big pelvic floor that attaches in there. So sometimes if people are getting lots of pubic symphysis pain, we might, rather than getting them to do tons and tons of strengthening, we might initially get them to do some stuff just to relax those muscles, to lots of kind of deep breathing, lots of belly breathing. So a more kind of gentle pelvic floor approach. Because sometimes those women, when we question them a little bit further, they're also maybe getting some signs of maybe urinary frequency, so they're having to wee quite a lot. They're maybe having a little bit of discomfort on bowel movements, and they also may be getting some kind of, you know, some vulval symptoms, clitoral pain, or a little bit of pain on intimacy. So and I think coming back to the first question is that although we are kind of in, you know, a COVID-19 kind of lockdown at the minute, getting some general exercise is really important, because what that pelvis doesn't like is being in one position for long periods of time. So getting up, doing some weight bearing exercise, getting out for maybe that bit of stroll with the buggy, maybe if there are older children, and also trying to, you know, find a brilliant postnatal PT local to you who can maybe see you either in their clinic if that's still happening, or can see you online. But there's lots to do, and I think to reassure these women is that we know that pubic joint is a very stable structure. It does not come apart. It's not unstable. It's more so that the pain is probably coming from some of the tissues attaching to it. And, you know, it's still quite safe to exercise, but maybe to kind of build that up gradually. Would you like to add anything, Jeanice?
Yeah. So I would, again, kind of let your body is giving you some warning signs that it may not be ready to do what you're doing. But if you're just getting out of bed, how do you not do that? So I think a simple tip that one of my friends gave me that I really like, and I think it's a good visual, is to move like a mermaid. So like when you're getting in the bed, I'm going to try to see if you can, you know, so basically we're keeping our legs together. So we're moving like a mermaid. If you're going in and out of a car, so sit first and then swing your legs together. So you're trying to avoid a lot of that unilateral movement, keeping your legs kind of together, and also looking at your sleeping posture. So are you sleeping in a crazy way with one hip way up, you know, or kind of thinking about putting maybe a pillow in between your knees, and just being very gentle with your movement. So moving like a mermaid. And then some people do find relief from wearing like an external support brace. There's varying outcomes on the research. You know, we can't say that the brace is going to help everyone, but some people having some external support there on their pelvis, it feels really good. And again, if you're at home and you don't have that type of brace or the money to buy it right now, I would try some of those compression garments, you know, like exercise leggings, something that gives you some external support there, because maybe your muscles aren't doing everything that they need to right now, and it's going to take some time and a little bit of extra help. Also, I'm going to share maybe at the end of this segment on our website and also on our YouTube channel, we have a lot of free resources on most all of these topics that we're talking about. So I'll kind of walk you through how to get there, but I have one whole interview, about 45 minutes, just on pelvic girdle pain during pregnancy. So I think that might be helpful.
Brilliant.
Okay. Thank you. You know what? Am I saying your name right? Because I'm saying Gerard, but then
I'll go with that.
No, well, okay. How do you say it? Please help me.
Gerard.
Gerard. Gerard?
Yeah, it's kind of like one. Yeah, it's kind of shortening the syllables.
Okay. I'll try. I'm so sorry. I've been slaughtering your name for the last several months. But when I heard, we were on an interview earlier this week, and I heard Grania, and I probably haven't gotten her name perfect yet.
No, that's fine. Grania, yeah, you got Grania's.
Okay, good. And I heard her talk to you, and she didn't call you Gerard. I was like, oh no, I've been saying it wrong. Okay, so what could I have done to prevent pelvic floor issues and prolapse? I mean, that's the big question.
I think sometimes, you know, mums are really hard on themselves. Mums are hard on themselves, and sometimes, you know, it can be it's, you know, having a new baby or having older babies or toddlers is, you know, it's hard work. And I think sometimes mums can be a bit tough on themselves, thinking, well, if I had done something differently, maybe I wouldn't have this condition. Or sometimes it's quite tough on the mums that, you know, there may be not, that postnatal period is not as enjoyable as it should be, because they may be getting pelvic girdle pain still, maybe they've had some birth trauma, maybe they're getting symptoms of prolapse, or they're having, you know, they're not feeling very good about themselves, they're maybe having some postnatal depression. So sometimes I think I'd probably shift the emphasis to, you know, not that they could have done something differently, but at least now they are maybe starting to take time to put themselves first. And we know that in that kind of postnatal period, you know, there are things that lead to a higher incidence of prolapse. There are things that lead to a higher incidence of urinary incontinence. And one of the key things that is, which is somewhat kind of out of the control of them, is whether there has been some birth trauma. You know, if someone gets a grade 3 or a grade 4 tear, so that grade 4 tear is going into that kind of rectal sphincter, that those women will get a lot of maybe bowel symptoms. We know if someone's had birth trauma, maybe on a forceps delivery, that their incidence of urinary incontinence will be much higher, and maybe their incidence of pelvic pain will be much higher. I think in the postnatal period, the things that are good to do is to, you know, trying to find time, whether that's physical time or mental time, to, you know, prioritize yourself and seek help from one of your kind of brilliant, maybe local postnatal physical therapy specialists, maybe from one of your gynae colleagues. And then it's also, you know, to see, can you find time to get back into doing some of the pelvic floor exercises, trying to do some gentle exercise, trying to look at things like diet, toileting position, almost things that kind of put mum first for a change, really. And I know, like, I'm sure it'll be interesting to see what you think, Jeanice, is that, you know, I will commonly see mums who, like, one comes to mind, one of our really experienced midwives, where in the kind of community I work with. Now, her kids were, I think, 15 and 16. And she had, you know, she had urinary incontinence that was preventing her from running. And she knew she had this. And she said to me, she said, you know, she said, I kind of feel it's only now that I can have this time to sort myself out. And obviously we don't want people to wait that long, but you know, it's a case of it's never too late to get these problems sorted out. Like,
I agree.
Would you like to add anything, Jeanice?
Yeah, you know, I would just, like, in terms of prevention, we don't, you know, we don't have that answer, and putting that on yourself, like, you can do everything. You can have a magical birth plan, you can have everything laid out, but there's so many elements that are outside of your control. So at whatever point you are now, just accepting, okay, understanding this is what's happening to my body, because I think knowledge is power. So understanding, and then knowing that there are proven interventions that don't involve surgery that can help you. So, and sometimes, yeah, maybe sometimes surgery is indicated, but, you know, conservative options first. And I think my key word in the postpartum or the postnatal period is support. So I love pelvic floor support. And I also love to start off, just if you're having those symptoms, think about the role of gravity on your pelvic floor. So gravity is pushing everything down. Let's just get that pelvic floor tilted up. So put your hips up on a couple pillows, and occasionally, that feels really good to relieve some of that pressure. And like our earlier question about baby wearing. So if you're having symptoms with some of the things that you're doing, reevaluate what you're doing, and are there some strategies that you can use to help give your pelvic floor some extra support. And you don't have to be super mom, because we want to do everything. We're not putting ourselves first. We're not getting good rest, maybe not good nutrition. And now with all of this, we may not be getting outside very much. And all of these things are an important part of a healthy lifestyle. So taking time for yourself, giving yourself support. And I would also just remind you and encourage you, you don't have to lift everything. So instead of lifting, try to push or pull, or let somebody else help you. There's no, that's not a negative, to accept help, especially as that pelvic floor is healing. It just went through a lot of trauma, especially if you had a vaginal delivery.
Exactly,
So
exactly.
Heal. Good. Okay. So maybe we'll do 1 or 2 more questions on this segment, and then we'll pause it and move on to the next segment. So what are some of your favorite pelvic floor relaxation cues?
Yeah, I'm really glad someone has asked this, because I think there is an idea that the only thing mum should be doing is contracting, working hard. And that's not the case, really, in that we do see groups of women who need to do more pelvic floor relaxation, because it may be that pelvic floor may be due to pain. It may be that there's some residual pelvic girdle pain. It may be that there has been some birth trauma. It may be that there is that woman maybe has previously had some maybe pelvic pain, maybe some kind of genital pain. They may have had previously pain on intimacy. They may have endometriosis. So that it may be that those muscles are predisposed to getting a bit overactive, generating pain. And I think probably before I kind of go through what I find helps relax them, I think it's good for mums to know, might relaxation be something that they need? So I think the symptoms that we look out for, that tends to tell us this woman probably needs to do more relaxation. And I think especially at the minute where we here in the UK, where all of the physios are doing online work. So we really spend a lot of time kind of asking the mums questions. So are they getting pain? So are they getting some kind of pubic symphysis pain? Are they getting some kind of genital pain? Are they getting kind of vulval clitoral pain? Are they getting rectal pain? Are they getting pain in that underneath area, that perineum? So pain in that area is maybe starting to be suggestive of a pelvic pain problem. Also, is there pain on bowel movements? Is there incomplete emptying? That really means that there's maybe a little bit of maybe light soiling of underwear, or they just can't get clean. Or sometimes the mums will say, well, I only really feel like, that I can only do a bowel movement at home, because after I do a bowel movement, I need to jump in the shower. Or it may be that there may be some pain on urination, or maybe kind of difficulty initiating, or that there's urinary frequency. So this is starting to build a picture. So they're complaining of pain in those areas. They're maybe getting some bowel pain, getting some maybe pain in urination, some urinary frequency. And also there may be some either pain on intimacy. So pain during masturbation, pain on penetrative sex, pain maybe on vaginal examination, pain on using tampons. So there's some kind of internal symptoms there. So when you start to get when a lady gives you those symptoms, then you're thinking that's probably more of a pelvic pain type presentation, and that tends to have more of an overactivity. In terms of relaxation of the pelvic floor, I think the thing that I like is doing a lot of belly breathing, I like. So that may be belly breathing, maybe in lying to start with. So you've got a really nice, big supported area. And this may look easy because obviously Jeanice teaches people how to do this, but this isn't easy because a lot of patients will really do this kind of sternal upper chest breathing. So sometimes it takes a while to teach people that. And then a progression might be doing that with the kind of hips lifted up, the calves, legs supported on maybe a couch or chair or the wall. So really getting a nice kind of stretch into that perineum. Doing some breathing in pigeon pose. So kind of sitting back, almost kind of sitting back on the heels. And then also getting, once someone is able to do that and they feel happy, confident doing that, another really nice way to get a little bit of pelvic floor relaxation is teaching people to do some reverse Kegels. So a Kegel is a contraction, whereas a reverse Kegel is like a gentle kind of lowering of the pelvic floor. So the way I like to do it, and there are different ways to do it, the way I find is good is getting the mum to take a nice deep breath in, nice big belly breath in, and then as she's breathing in, just a very, very, very subtle, gentle pressure down through that back passage, but emphasis on gentle and subtle. I think another thing that helps relax that pelvic floor that the mums can do on their own, because at the minute the mums are, in most places, I know there are exceptions in the States, including Jeanice's clinic, is doing some kind of hip spinal movement that we've kind of looked at already, kind of getting that movement area, or getting that area moving, doing some light kind of self-massage to that abdominal area, because we generally find, the pelvic floor, if it needs to relax, those abdominals need to relax. And I think the big thing that comes with pelvic floor relaxation is that a lot of those mums, if they have overactivity, they can have, you know, high levels of anxiety about that, higher levels of stress, and because it is, you know, having young children is a stressful time. And things like headspace, mindfulness, getting out. I tell the moms, you know, although you want to be with, if they have a partner, you might want to go out and walk with your partner and the kids. But I think it's for them to get out themselves also.
Mm-hmm. I agree.
Do you want to add anything to that, Jeanice?
Yeah. So I like, along with that, you don't always have to have something going. So if you get a little time, take that time. And you don't always have to fill every minute with a podcast or with music even. If music is relaxing, fine. But sometimes you just need some quiet, you know. I think I love what you said. I like to use the analogy of like the overactive pelvic floor muscles as the fist. So if you visualize this as your fist and your hand, what if your hand was squeezing all day long, all day, all night, all day, all night? How functional is this going to be when you go to try to use it? Even after me squeezing for 20 seconds, you know, it's a little bit stiff when I open it up because that restricts the blood flow. It can even, you know, give nerve damage ultimately. So you need multiple components. So you need to be able to contract, but we also need to fully relax and let go. And then that's gonna enable function because the pelvic floor has different jobs to do. So brilliant. I love that. I think, let's see, one more question. What can I do before pregnancy to prepare and strengthen my pelvic floor?
Okay, so I think there are some really nice guidelines on what is beneficial during pregnancy. And we've got some UK guidelines. We've also got the USA guidelines from the USA Obstetric Organization. I'm not saying that right, but
ACOG.
Yeah, ACOG, yeah. So one thing that's really recommended, which helps both general health, and it'll have a secondary effect on pelvic floor function, is exercising during pregnancy. There's really strong evidence that general exercise during pregnancy leads to less complications. In an uncomplicated pregnancy, it's recommended that people do about 150 minutes a week. So exercise is beneficial. Taking exercise during pregnancy will lead to less complications.
Yeah. I think that's a common myth, is that people think, well, number one, I'm pregnant, so there's nothing I can do, which is not true. And then number two, man, I just forgot what I was about to say. I'm so sorry. Basically, yeah, go ahead, please, because I completely just forgot.
Yeah, so I think the question was really, well, what can I do to prevent maybe pelvic floor problems kind of posing? So I think kind of taking a more general look at that, I would say that activity and exercise is really important.
Absolutely.
I think I think that would be my one of my big messages is, and you know, I grew up in Ireland, and you know, there was a lot of traditional beliefs there, and in the UK, that exercise, and up until probably recently in the literature, you know, exercise was kind of frowned upon during pregnancy, whereas now exercise is promoted.
Right.
And you know, I've been fortunate enough to teach in several countries, and I spent some time in Japan in September with some, you know, wonderful people. And I think in the Japanese society, it's still, you know, first mums are very kind of sheltered, protected. They shouldn't do very much because it might be dangerous. So I think that's one myth that's starting to be moved away from, in terms of get these mums to get them to continue exercising, and also those who maybe haven't done much exercise to kind of get them gradually doing some exercise.
Yes. And I remembered while you were talking. So basically the second thing I was going to say is, a lot of times people are told, don't strengthen, don't work on your pelvic floor during pregnancy, because it's going to make your pelvic floor too tight. And there's actually some research that can show the opposite. So it's healthy to exercise your pelvic floor, but you want to make sure that you're doing both. So understanding how to contract, but then also how to relax and let go. So I think this was a wonderful segment. I'm basically, if you have any questions, I would go to mypfm.com and click on Get Help, and then click on About My Body. And a lot of these topics I have a little infographic on, and if you click on that infographic, it takes you to a ton of more information. So that's one resource that you can go to. Gerard, man. Gerard, I'm so sorry. Mr. Green, how about that? Mr. Green,
no,
do you have any resources?
I'm in court.
Do you have any resources? If you're doing online consults, do you have any resources that you would like to connect them with?
I think this is probably relevant to COVID. Well, this is very relevant to COVID-19. I think there is a lot of misinformation out there. I think that there is a lot of myths out there about COVID-19, particularly around pregnancy and postnatal. And I think what we have really highlighted on all our kind of social media and website is that if women have concerns about, well, how might COVID-19 affect my condition, or how might COVID-19 affect my baby or me postnatally, is rather than trying to look at some of the tabloid newspapers or some of the kind of stuff on Facebook, is, so in the UK, we've got the UK Obstetric and Gynae Association guidelines. And in the States, you'll probably have ACOG guidelines on COVID-19. So I think my point is, when you're looking for medical information, COVID-19 and pregnancy, you know, go to those really reputable, trustworthy sources.
Don't believe everything you see on Instagram or Facebook or TikTok. Go to reputable sources. Okay. So thank you so much for your time. And we hope that you guys found that valuable. If you have any other questions for us, you can contact us on Instagram. Mr. Green, Gerard is on, I know. I got it. Okay, good. He's on Facebook too. And so we have a lot of different ways to connect. So thank you very much for joining.